So students who came to know recently about the TN MRB annual planner, so they called for some dental specialist, Sheila. So regarding that, so we are going to see in this particular orientation program everything related to the TN MRB, what to study, especially what not to study, what the department we can expect, when we can expect the notification, everything in detail. We are going to see in this particular orientation part, right? So this is the movement we have been waiting for almost 12 years students. 2014, they called for the dental specialist. After that, 12 years we taken for the so movement we are waiting for. Actually, it's a very, very good chance for the dental specialist who have completed the MDS recently in the last 5 years. Because actually, the dentists who completed more than 5 years, actually, I'm talking about MDS, probably they settled in the clinic or maybe they settled in the college. And this is a very good opportunity. Those students who completed MDS in the recent years. Right. How many posts actually they called for? They called for 31 seats. It is given in the TN MRB annual planner. It is an official figure. Right. But it doesn't know when we can expect the notification. Also, it's in the later, right? So this is a dream you deserve. And the students, you know this, right? So there are a lot of clinics, lot of competition. Every day we are running from morning to night, but we doesn't have good financial stability. So we don't have even job security. So these are the drawbacks. What we are in the day-to-day activities, most of the MTS we are facing actually. But if you go to the MRB, what are the advantages you may get? So number one, financial certainty, like it is a very good salary. And if you ask recently, TN MRB happened last year also in 2025. I asked many of the students what is the salary, initial salary. The initial salary itself more than 80,000. Okay, and very importantly, they have a good work-life balance because most of the dental related jobs in government hospital and colleges, they have very limited hours of working. Okay, so have a good work-life balance. So have a good DA, HRA. Every year, actually the DA and HRA will be increased. And you have recently, you know, this last year, the Tamil Nadu government actually planned to bring the old pension scheme with some changes. That is a very huge advantage. You go to the TN MRB, not you can see in the private practice or your clinical practice. And obviously, professional respect, obviously, a rural area, you know that. So the respect they given for the government doctor, actually, yes, so these are the advantage. But there is a one question in everybody's mind. Is this too early to start? Because no notification is come yet. Okay. But those start students, I tell you one thing which is very important for you. So last year in TN MRB 2025 for dental, so the date of notification, just see this, it is about February 25. The application opened on March 17 and the exam is April 24, almost 60 days. Okay, 60 days is a very, very small amount of time to prepare the whole 20 subject and decision. That is why if you see the last year, most of the students who cleared and they got the seat in the TN MRB are the students who prepared already need preparation students who have started after the notification. Very few students selected in the TN MRB. So if you're waiting for the notification, actually that particular time, 45 days to 60 days is not at all enough. So from the ArdentMDS, we just wanted to give some huge edge, huge advantage to the students. So that is why we started the preparation for the TN MRB as earliest when no other center thinking about this. Right. So let's talk about. And so we have only the 60 days, but what is my assumption? What is my guess? If you start your preparation now, so you have a minimum of 4 to 5 months. So comparatively, it is more than your 60 days time. So obviously, so the game is like students, it is about speed. Speed is the game actually. Yaar seekama start பண்றாங்களோ, யார் fast prepare பண்றாங்களோ, that is actually gives the success. Okay, so because but now it is actually easy. Think about like suppose you are an MDS. Okay, suppose a common actual MRB exam வருது. அப்ப நீங்க PDS ஓட காம்படிட் பண்ணனும். PDS ஆல்ரெடி நீட்டுக்காக ப்ரிப்பேர் பண்ணிட்டு இருப்பான். ஸோ அப்போ ரொம்ப ஸ்பெஷலிஸ்டுக்காக கால்ஃபார் பண்ணியிருப்பாங்க. அப்போ ஸ்பெஷலிஸ்ட்டுக்கு தான் ஆக்சுவலாக காம்படிஷனு. அப்போ மற்ற ஸ்பெஷலிஸ்டோட நீங்க காம்படிட் பண்ணி முன்னாடி வரணும் அப்படின்னா நீங்க சீக்கிரமா ஸ்டார்ட் பண்ணீங்க அப்படின்னா தான் ஸோ ஈஸியா உங்களால சக்சஸ் மீன் ஹையர் மார்க்ஸ் வாங்குறதுக்கு முடியும். ஆக்சுவலா what is the age limit according to the 2025 notification? I'm talking these things. Okay, for an SC, okay, MPC, TC, PC, everybody 15 years. I don't think anybody here listening this maybe 15 years. For other category, that is open category, it is 37. Differently abled 47 and ex-serviceman, it is 50 years. Okay. So coming to the exam pattern, students, the exam pattern is actually there are two exams. So one is like Tamil eligibility, the second is about the dental medicine or the dental subject. Usually for the dental subject students, it is actually 100 marks, 100 questions, 100 questions, 100 marks, no negative students. Okay, that may be advantage or disadvantage also. Here it is a disadvantage for the students who preparing well. Yes, so for a hour, you have to complete only the 50 questions. Just imagine when you appear for the NEET exam, you have to be do 80 questions per hour. So 240 questions, 3 hours. So your mind is actually practiced for that. No, this is so easy actually, right? But what is the problem here? The paper is easy, the time management is easy. But what is the competition? The competition is the huge difference here. Okay, so there are so many students will appear. Okay, so last year you know that so the cutoff is just completed within 2 marks. Just started at 87, 86. Some of the students who got 85, they got. So some of the students they not able to get it. Okay, so the competition is too narrow actually. So even a 1 mark, 2 marks, which is determines the rank, TN MRB rank and seat. Right, and if you have a Tamil eligibility test students, Tamil eligibility test is for 1 hour, 50 questions. And what is the eligibility mark? So the eligibility mark is 40%. What is the meaning of 40%? That means you have to get 20 marks. Okay, 20 marks are along easy than actually. So, students, I repeat one more time, it is a Tamil eligibility, they won't consider Tamil marks for your merit list. It is just for eligibility. Okay, so the eligible ஆனாதா இந்த மார்க் எடுத்துப்பாங்க. Okay, maybe you think that 20 marks எடுக்க முடியாதா? Actually, the Tamil eligibility test கேக்குற Tamil questions is not you studied what I studied actually. Now the syllabus is completely changed actually. So you have to give at least a minimal time for the Tamil eligibility test preparation. Without preparation, tracking Tamil eligibility is almost impossible, I can say. Okay, but it is possible. It is possible if you prepare at least give minimal time for the Tamil eligibility. Actually, last time I know personally one student actually he got a very good mark in dental, almost 86, but actually he not able to clear the Tamil eligibility, so he missed the opportunity. Okay. So once in a lifetime opportunity is this, so you should not miss this, right? So what is included in the Tamil eligibility paper? Almost they given the syllabus of from the 6th standard to 10th standard books, but actually you need not to study everything in detail. Selectively our faculties, so we discuss, we take the classes, whatever it is needed. So last time Tamil eligibility ArdentMDS register for the students almost clear actually. So many of the students after came from the exam halls, immediately they called me, sir, actually the same question, what is discussed in Tamil eligibility came in the exam. So many students actually given the call. Yes, students. So what is the application fees actually for SC students? It is a 500. For other category students, it is 1,000, right? So students, why even the toppers, even the brilliant students who are failed in the TN MRB opportunities? So maybe they wait for the right time. So maybe they have some works related to the clinic college. Maybe they think once they complete it, they will start the preparation. But actually, the problem is time. So what is the game? The student who started the earliest has a high chances to success. I'm repeatedly telling this. So they underestimate the competition because students actually within 1 year, almost 800 students are completed from the Tamil Nadu. So almost just if you take everything 2 years, so almost 1,600 students actually clear the MDS coming out of the colleges in Tamil Nadu. So it is a huge competition. and they rely on the notification. So they believe that so after the notification comes, we'll start. Well, I'm telling this. After notification, you have a very, very minimal time, 45 to 60 days. It is not at all enough to crack the competitive exam. And they don't have any structured plan. Okay, randomly they prepare. So one day maybe they start with the oral surgery. So other day they will start with the pharmacology, and then with a gap of 2 weeks, again they start one subject. They don't have no tracking system actually. So what is their rank? So what is the score? So whether they are doing good preparation, so nothing actually. So for any competitive exam, you have to think about these three things. So one is like clarity. Yes, exactly what to study, what not to study for this particular competitive exam. So actually in ArdentMDS, we are so clear. Okay, last time almost more than 900 students registered in ArdentMDS for the MRB preparation and the consistency. Okay, obviously this is a magical word in any competitive exam. You have to prepare on a daily basis. Okay, only if you do the common consistent preparation, you can be able to complete the syllabus on time, and you have the remaining time for the multiple revision. Again, I'm telling revision is the key for success. You have to do multiple times revision, students. Okay, so yes, the third one is actually obviously have this. So Ardent MDS, which help in this area, which is for the strategy. So the test analysis, so weak spot fixes, smart revision, everything will be taken care of for the students. Right. So now, what are the TN MRB opportunities, students? So why I am telling this is a very good opportunity? There are some reasons. It is a permanent government job, which is not contract basis. Open to all MDS graduates from the recognized university from Tamil Nadu. Okay, or if you have a nativity related to Tamil Nadu, yes, you can apply. And you have the two-paper system. One is for the dental subject, one is for the Tamil paper. And the selection is based upon the written exam. There is a no interview process. So I am posting across Tamil Nadu. I am thinking about various dental colleges and district headquarter hospitals are will be posted by this. Right, and you have the service count towards the government pension. Recently, they're talking about the pension scheme also. Okay, and the expected notification approximately 60 days before the exam. This is a likely one such requirement in next 3 to 5 years. Okay. Okay, next to 5 years, I don't think there is a one more opportunity you may get it. Okay, minimum I am talking. Okay, 3 to 5 years, no matter opportunity, we collect as students. That's and repeatedly telling. So very good opportunity. Okay, right. So obviously, minimal number of students. Okay, minimal. Okay, I'm expecting like maybe 3,000, 4,000 also. I'm talking about the least number of students may appear for this exams. 2,000 plus for 31 posts. Okay. Competition ratio 65:1. And you can expect the notification 60 is right. Students. So what is the real challenge? Okay, when you start your NEET MRB, sorry, not NEET, MRB preparation. So what is the trap? Okay, if it doesn't have a structured plan, maybe okay, you doesn't know what to study. Okay, you maybe study everything. So that maybe the information overload. It is not about knowledge, students. It is all about like what is exactly needed for your exam. You have to prepare it. So that is very important. Obviously, there are many students, so they have slightly taken the Tamil eligibility paper and probably don't have no study time. So maybe you occupied with the clinic or college duties. So waiting for the official notification. Okay, and you may take the self-study. So students are taking self-study is the self-work. Actually, in your competitive exams, because you don't have track of your progress and you doesn't have proper guidance like what to study. Okay. So these are the problems. And so here we play actually. So in Ardent MDS we play. So we have here clear plan for the TN MRB preparation for the next 4 to 5 months. Right. So in Ardent MDS we have starting the preparation as the earliest. Follow the structured weekly system, topic-wise revision cycle, monthly once mock test. Tamil is integrated from that month to one, weekly accountability, okay, for the consistency. So you'll be confident and you'll be ready for the exam whenever the notification comes. Okay, right. Now, students. Okay, so we have the okay, what is our goal actually? Okay, so what is our mission? ArdentMDS mission for this 2026 is so there are 31 vacancies. We just wanted to be all the students okay, to be filled in the 2026 MRB should be come from the ArdentMDS 31 ArdentMDS selection. Right. So is what is we do actually for the TN MRB? So it is structured curriculum students. Structured curriculum. So we have almost 4 classes per week, and you have the analysis and tracking system. So you have the live classes plus the recorded classes. So mentor-based system. Okay, it's still clear. It's still clear. You'll see this. So students, actually we have 4 days classes. Tuesday, Thursday, Saturday, Sunday, you'll be having live classes, especially on evening times. Okay, except on Sunday. Sunday, you'll be having classes from 8 to 10 a.m. morning. Okay, 8 to 10 morning. Okay. In case if you missed the live session, you can go through the recorded session also because the same live session will be uploaded in the app. So you can go through the recorded session, and every single month will be having the mock test. And you have mentored by Dr. Karthikeyan, that is myself, and you have the analysis. So weekly report will be given when compared to your competitors. Master leaderboard. Okay, so there will be weekly test, which is called as master leaderboard. So you have to know. So what is your position in the master leaderboard? Obviously, Tamil eligibility is included in this plan. Yes. So this is actually a good schedule, students. Right. So now, so there is a big question. So usually there are many students called me and they asked one doubt, which is a very common to okay all the students. Okay. So what is the doubt? Okay, in case okay, I just started my preparation. Okay, and I joined in ArdentMDS. In case if my specialty is not coming in the notification, so what I should? Okay. So for example, if you are a prosthodontist, okay, so you just started your preparation with ArdentMDS. Yes, so you are doing well. Okay, notification comes after 2 months. Okay, or 3 months. We doesn't know anything about notification. It doesn't know. It's just a guess. Okay, my guess is maybe 2 or 3 months later you can expect the notification. Only my guess. It may be right or wrong. Okay, right. You started your preparation. Notification comes. There is a no process department in the seat matrix. What I should do? Okay, these are most students asking. Okay, so for this, okay, so ArdentMDS we have something called as ArdentMDS guaranteed plan, okay, which no other center dared to think of this. So what we do? So we want the students to start the preparation at the earliest 1 5. Meanwhile, students. Actually, suppose in the particular department, the students so ethically we find out one way which is beneficial for the student. Okay, so what does that mean? In case if a notification doesn't come, students, 80% of the money course fees is refunded to the student. Okay, so for example, okay, you just okay take a rank and you take the risk. Yes, so when I just go to the course fees, I'm explaining that in clear. So what is the 80%? What is the 20%? Yes, students. So this if we go to the Google review platform, probably you can see our students' reviews in the ArdentMDS, right? So just imagine, just do the manifestation. Just do the manifestation 6 months from now on. So the results are out, your name is on the list. So this is the manifestation you should do on every single day morning. So with the preparation students, if you do manifestation, whenever the hard work and manifestation join together, success is unstoppable. Right. So yeah, so this is what. So if you start your preparation now, so this is your advantage. So coming to the different type of courses, We have designed 3 type of courses as of now for the TN MRB preparation. One is like offline, online, and Tamil. So what is like online? Let's see this. Okay, so we'll be having a live lecture, a recorded lecture, and you will be having the mentoring, okay, from myself, and you can study anywhere, right? So we'll be given the app. So to go through the recorded lecture. So weekly once, not weekly once, actually weekly 4 times we have the live session. Okay. So Tuesday, Thursday, Saturday, and Sunday. And test weekly 2 tests, monthly once mock test which include all the subject based upon the TN MRB pattern, and will be provided Tamil eligibility test also monthly once. So everything which is included here, student will be providing the app support also, right? The course basis 15,999 students. Right. So this is an yearly code offer. This is the yearliest. So in case if your department doesn't come, okay. So as I told, cross department doesn't come. Okay. So let's see. So 16,000. So among this 80%, okay, will be refunded back. So your course fees after refunded, so it will be only 3,000 rupees. Now decide is the 3,000 rupees the risk you are taking extra. Okay, suppose if you not start your preparation, okay, so this one is nothing, right? So almost to this 15,919 is equal to like if you got selected, probably it is an 8 days of study. Just 8 days of the study. Okay, so start your preparation and offline students. So then the offline actually, so what is offline is okay, probably if you want to prepare the whole day, okay, so if suppose you are thinking like TN MRB is my life, okay, just wanted to crack bad, so I have to prepare day and night. So this suits for you actually. Offline, so offline is working in my center, showing in Nadu, ArdentMDS. So you have to pack up everything just to come here. We provide the study hall, okay, with the separate cabins. You study here from morning 6 o'clock to 10 o'clock. The study hall is open. We'll be preparing daily discussion will be there. And apart from the same live lecture, recorded lecture will be there. So no distraction. So with that, my complete direct mentorship. So definitely the chances of success is very, very high in this offline. Yes. Obviously, if we have a good discipline, yes, online is also suitable. So if we have some family commitments, okay, college commitments, we obviously cannot come for offline. So even with a proper discipline, the structured manner, if you prefer, yes, it is possible even with online. Right? So there are students who only actually want to come in. So for this student, we actually facilitate some course. So this is the course details for the Tamil only classes. Right. So students, you have to think about this. Your next 35 years of your life actually depends upon one decision. Like what is that one decision? To start preparation or the delay preparation. Okay. So that is the one decision you have to make. So students, this is my team who's actually teaching for the TN MRB. This is myself, Dr. Engi, for orthodontics. Dr. Ashwin actually recently completed in GDC Chennai, taking care of the oral surgery. And Karnanadi from Meenakshi Ammal Dental College, he is taking care of the community dentistry. And Dr. Jadid is professor from Chiknadi Dental College, he is taking care of the Roscoe. And Dr. Sanjay, who is taking care of the basic science. Entire periodontics, entire basic science with endo, dental materials, operated dentistry will take care of myself. So student, we are waiting. Yes. So start your preparation seriously, as I told. So this time, 31 vacancies, 31 seats, which is actually my mission. My vision is all the 31 seats to be come from Ardent. Okay, so best wishes. Thank you.